So today we're taking a look back at the year of office hours, what we've learned, how practices grew, and most importantly, how you can carry these strategies into a strong, compliant, and efficient plan for 2026. We've shared these office hours with over 50 different practices throughout Riverside, and we're very excited to have you all on these calls. So thank you again. So we're going to start with this year and what it looked like from a very high level. So we delivered more than 40 different focused training sessions that gave practices practical, ready to use tools for improving operations, billing workflows, and patient access. Throughout the year, we also spent a great deal of time strengthening workforce skills, everything from communication and team meetings to conflict resolution and leadership development. Every recommendation we shared was grounded in compliance, ensuring practices stay aligned with the HIPAA, Cal OSHA, billing laws, and of course, evolving care requirements. And most importantly, each session responded to real world challenges that you told us you were facing. So, no show spikes, access delays, documentation gaps, all of those day to day pressures of running a medical practice in California. And to make this recap a little bit easier to digest, we regrouped the sessions into categories. So these 6 different categories represent the core building blocks of a strong, compliant medical practice. We started with front office excellence and patient access because that's where every patient experience and billing outcome begins. From there, we focused on communication and workforce development to strengthen team culture, reduce turnover, and create consistency across roles. We moved into practice efficiency and workflow optimization, giving practices tools to streamline processes and reduce bottlenecks. Our revenue cycle management was another major area this year, ensuring that billing was accurate, clean, and compliant from the very first patient interaction through to payment posting. We also spent time on care coordination and quality, especially as state and federal requirements continue to evolve. Finally, we addressed operational oversight, an often overlooked category that includes vendor management, supply processes, administrative structures that support both compliance and financial stability. So let's walk through each category and the key trends that we saw this year. So in the front office excellence and patient access category, we focused on the areas that most directly shape both the patient experience and the financial health of the practice. We looked at improving patient payments and collections by strengthening those upfront communications and transparency. We spent time on reducing no shows and optimizing scheduling so that appointment capacity is used efficiently and patients can access care when they need it. We covered pre visit planning to reduce day of bottlenecks and support clinical readiness. We also talked about that overall access improvements and front desk quality because accuracy at the front end prevents billing errors, complaints, and of course, downstream delays. And for practices working with health plans, we address the issue of assigned but unseen patients, helping teams identify gaps, re engage those patients, and then meet access expectations. Another major area of focus was strengthening the team itself. So, in our communication and workforce development category, we focused on the internal structure of the practice because a well supported team creates a safer, more consistent patient experience. We talked about how to run effective team meetings and use clear communication strategies to reduce misunderstanding and improve your staff accountability. We covered conflict resolution and one on one tools for addressing issues early before they become complaints or HR challenges. Delegation and emotional intelligence were also key themes as well, helping leaders trust their teams and build confidence across those roles. We also looked at the difference between coaching and correcting and how supportive guidance improves both performance and morale. All of this ties directly into employee retention, which continues to be one of the most pressing challenges for our practices in Riverside. Once the team is strong, workflows become so much easier to optimize. So that brings us to our next category. In the practice efficiency and workflow optimization category, we focused on the systems that keep a practice running smoothly day to day. We talked about time management and stress management equal, not just as productivity tools, but as strategies to reduce errors and improve patient interaction. We spent time on cross training so practices can maintain continuity when staffing is tight or when turnover occurs. We also addressed documentation support, helping teams streamline work without sacrificing accuracy. Chart prep and care gap closure were also major themes, especially as payers increased expectations around timely follow-up and quality metrics. We discussed empanelment and access strategies to balance provider workload and improve availability for those assigned patients. And throughout all of this, we emphasized that building patient confidence because efficient, well-coordinated workflows lead to clear communication, shorter wait times, and a better overall patient experience. And of course, none of this can function without a clean, compliant revenue cycle. In the revenue cycle management track, we focused on strengthening the entire financial workflow from the moment a patient schedules to the final payment posting. We looked at merchant statement review to help practices understand those processing fees and identify unnecessary costs. We walked through clean billing workflows and how to manage patient billing inquiries in a way that strengthens that trust and reduces complaints. Charge capture and front-end payments were also major themes because accurate information at check-in prevents denials and delays those downstreams, as we mentioned. We also covered denial prevention strategies and post-visit collection to support that financial stability. And importantly, we discussed that new California laws, such as those related to medical debt and patient communications, supporting that, also helping practices stay compliant with regulations that directly affect those collections, credit reporting, as well as financial transparency. Next, we'll shift into care coordination and quality, and those are areas that directly affect the patient outcomes. So in this category, we focused on strengthening the connections that support safe, timely, and patient-centered care. We spent time on referral management and how to close the loop with specialists to meet MCP and CMS expectations. We also covered lab and radiology workflow optimization, since delay in results are often, or follow-up can often create risk for both patients and providers. Team-based care was another key theme, using the full care team to support chronic disease management, patient outreach, and follow-up. We addressed social determinants of health support and how practices can identify and document those social needs in a compliant, meaningful way. And across all of these areas, we emphasized quality improvement strategies that help practices meet payer benchmarks and build stronger patient loyalty through consistent, reliable care. Finally, we closed the year with operation and vendor oversight. So in those categories, we looked at behind-the-scenes systems that keep a practice compliant as well as financially stable. We covered inventory management and how supply tracking supports both safety and cost control. We discussed vendor contract management, an area where many practices discover hidden fees or outdated agreements, even missed compliance requirements. Cost-saving strategies were another key theme, helping practices reduce waste and streamline administrative expenses without impacting patient care. And finally, we focused on administrative oversight, ensuring that leadership has clear visibility into those processes, performance, and regulatory obligations. These areas may not always be front of mind, but they play a critical role in maintaining a well-run, compliant, and resilient practice. So now that we've visited the content, let's shift into how you can take this information into 2026. So this roadmap gives you a structured way to turn everything you learned this year into real operational change. The goal isn't to do everything at once. It's to take consistent, measurable steps. When you follow this cycle each quarter, you build predictability, you build compliance, and a stronger, more efficient practice. Let's walk through each step of this improvement cycle. So we start with self-assessment. This is where you take an honest look at how your workflows are functioning today, where the delays are happening, where errors occur, and where compliance gaps may exist, whether it's staffing, patient access, or they are aligned with the demand of your practice. This gives you that clear baseline. Next is prioritizing high risk areas. Every practice has dozens of opportunities, but only a few represent real risk. So you want to focus on the big vulnerabilities first: billing integrity, documentation quality, patient access issues, and communication gaps within the team. Addressing these early prevents downstream problems with payers, audits, and patient satisfaction. And of course, staff satisfaction as well. Then we build the 90-day plan. Short planning windows create momentum. This means setting 2 or 3 measurable goals, assigning accountability, and choosing timelines that everyone understands. Keeping it simple ensures the work is achievable and the team stays engaged. Step 4 is updating your policies and procedures. As your workflows improve, those written policies should be updated to reflect how things should operate. This keeps you aligned with HIPAA, Cal OSHA, billing regulations, payer requirements, and even new California laws. Updated policies also give your team a clear, compliant playbook to follow. There's no questions when there's something there in writing for them to review. Step 5 is implementing a training plan for the year. Training is where change becomes real. This is where you map key office hour topics to each role: front office, clinical teams, billers, and leadership. Using our recorded sessions as quick micro trainings are going to help to reinforce expectations and build consistency across your staff. Finally, we end with quarterly review and reassessments. So as I mentioned, every 90 days, you want to have a plan, but then at the end of that, you check in. What improved? What still needs attention? What new regulations or new requirements have emerged since the beginning of that 90 days? And then you reset your goals for the next quarter. This keeps the practice moving forward without feeling overwhelmed. It also ensures that you stay compliant as expectations evolve. When practices follow these steps consistently, the result is predictable operation, stronger compliance, and more efficient, confident teams. So before we close, let's reflect on where your practice wants to focus first. So as we mentioned, these 6 categories, and of course there's multiple outside of this depending on the practice, but what do you want your top priority for Q1 to be? Is it in the front office? Do you feel that maybe it needs to be a more behind the scenes and administrative processes? Take a look at those and see if we can support you in any way.